Good morning, and I am honored to be here with Dr. Warren. She is our Assistant Superintendent of Equity, but also works with Health Services. And we want to talk about communication today, and communication around COVID-19 and the pandemic, and our sources of communication, and really what as parents and teachers and students need to know about how we communicate. First and foremost is we work with the Arkansas Department of Health, and Dr. Warren, they have a website.
They do, absolutely. We are constantly, matter of fact, every day in contact with the Arkansas Department of Health about any case, whether it be student or staff that comes before us. The thing that we have to remember is that we contact only those families that are in close contact to a positive case. Then we have to provide that information to the Arkansas Department of Health.
And then on their website, they provide each school district's current situation regarding cases, and it's cumulative. It's since the beginning, I believe, of the school year. You know, right now we can say with for certain, as certain as we can be, that we've had no internal transmissions.
Yes, and I want to echo that, Dr. McNulty, because the positive transmissions that have occurred have been a result of a sibling coming home from college or a family member that has had COVID. So we have not, I want to reiterate that, had any internal cases. Most of ours have just been close contact to someone else, to a positive case.
And then with the close contact, then we have our students or our staff members then end up to be quarantined. They're not necessarily sick. We're just taking the precautions that Arkansas Department of Health has advised us and directed us to take. Here's the thing that can really help. Because our transmissions are outside the school, it really means a lot to our operation of the district if we stop going to restaurants, for example, where you can have double the chance of getting COVID-19 if you're sitting inside. Stop having parties over with a lot of people that you don't know or where the contact is. I mean, these are things that happen outside the school district and outside our control, but they influence the cases that we see. We will contact you if your child or you as a staff member are in close contact, but keeping the PPE on has made a huge difference.
Definitely.
We have had no sicknesses with people wearing PPE.
Correct. And our staff and our students have done an exceptional job of keeping their mask on and keeping their distance. So I think that's been a big part of the success that we've had in containing this virus as much as we have.
Thank you. And again, we will, because of HIPAA and FERPA laws, we will only contact families regarding the close contact situation or a potential positive case. And that's just our obligation to the Arkansas Department of Health and our ethical standards. So thank you so much.
Now there are 574 active cases in schools. Channel 7's Paris Kane breaks down where they are and how one district is handling the cases.
State officials say the active cases will impact the school districts differently depending on the number of close contacts. So far, there have been 39 coronavirus modifications made to on-site instruction. Right now, the Fort Smith, Pulaski County, Springdale, Berryville, and Little Rock school districts have the highest active case numbers.
In many cases, if there are large numbers of staff affected in a school district, then the school district does have to make modifications.
Dr. Ivy Pfeffer with the Division of Elementary and Secondary Education says there's currently 22 coronavirus modifications to on-site instruction in Arkansas schools.
Each of these modifications are unique to the school district and unique to the circumstances around the need for the modification.
Earl Elementary School, Dunbar Middle School, Don Roberts Elementary School, Manila High School, Cedar Ridge High School, and Pocahontas High School all currently have modifications in place.
You can see that districts are really taking a measured response, really focusing on the needs in their school community.
Dr. Pfeffer also says a Pulaski County second grade class is shifting to virtual learning for the next 2 weeks. Due to HIPAA and FERPA guidelines, Superintendent Dr. Charles McNulty couldn't elaborate on which school was impacted.
I want to thank our community. We know it's hard. We know that we're following HIPAA and FERPA guidelines, and sometimes it feels like that you're not getting the information that you need.
The Pulaski County Special School District currently has 20 active coronavirus cases. Dr. McNulty says their contact tracers work around the clock to make sure anyone who's come in close contact with a positive case is notified to quarantine.
Why we feel comfortable is that when we've had to do contact quarantine, our people are coming back, they did not get COVID-19 through those contacts in the school. So we're feeling great about that.
Dr. McNulty feels utilizing PPE has protected students and staff and says so far there hasn't been any in-school transmission of coronavirus that they're aware of. Beth?
All right, Paris, thanks a lot. Since June, the Arkansas Department of Health reports a total of 2,919 cases of COVID-19 in public school districts.